I would now like to welcome you to our webinar, Advocating with Survivors Who Have Alternative Perceptions, Simple Strategies to Overcome Stigma. My name is Amanda Lyon, and I use she, they pronouns, and I am a training and technical assistance specialist with the National Center on Domestic Violence, Trauma, and Mental Health. Now for some troubleshooting tips about this platform. If you get disconnected from today's session at any point, please re-enter the session using the original webinar link that was emailed to you. If the sound is unclear, it's likely due to an unstable internet connection. If this happens to you, feel free to call in for a better audio connection. If you are experiencing technical difficulties, you can directly chat with Sarah Lee, also with the Center for Assistance. If you are unable to contact Sarah, please reach out to WebEx Tech Support. Sarah will post that phone number in the chat box. We welcome you to use the chat feature to share thoughts, questions, and resources throughout the session. Your screen may look a little different depending on what kind of device you are using. Usually, the chat box can be found at the bottom right of the screen. You may have to click on the chat icon that looks like a speech bubble to open it. Let's test the chat feature now. Please introduce yourself in the chat and let us know where you're joining us from today. I am joining us today from Surprise, Arizona, the unceded homelands of the Akimel O'odham, the Hohokam, and the Yavapai Apache nations. Arizona is home to 22 federally recognized tribal nations who have been the caretakers of this land for generations and who continue to practice their cultural traditions and thrive. Our center is headquartered in Chicago, the unceded homelands of the Council of the Three Fires, the Odawa, Ojibwe, and Potawatomi nations. We invite each person to learn about the land you are connected to. And one resource to get started is the website native-land.ca. The National Center on Domestic Violence, Trauma, and Mental Health is a special issue resource center that promotes an accessible, culturally responsive, and trauma-informed approach in the domestic violence field, and an accessible domestic violence and culturally responsive approach in the mental health, substance use, child welfare, and legal fields. We offer training and technical assistance, research, and evaluation. We also participate in policy development and public awareness activities. Our key perspectives include domestic violence and sexual violence advocacy that is survivor-defined and survivor-led, a trauma-informed approach for organizations, staff, and survivors, a human rights and social justice perspective to ensure that awareness of the conditions that create and uphold abuse, violence, oppression, and discrimination in our lives, communities, and society remains central to all that we do. Incorporating cultural, historical, and community contexts that recognize the richness and complexity of people's identities, beliefs, and experiences that serve as sources of strength and meaning. Our core principles include a survivor-defined approach so that each person has the right to define and determine what their needs and wants are, allowing control and choice over their experiences. Hope and resilience, believing in the human capacity to survive and heal, and recognizing the strengths, resources, and tools that survivors already possess. Physical and emotional safety, and honoring each person's understanding of what safety means to them, and a commitment to ongoing self-reflection and evaluation of whether systems, policies, and procedures are creating feelings of safety for both participants and staff. Within our work, we want to remember the importance of caring for ourselves and each other. This session discusses intimate partner violence, trauma, and mental health. This is a space that centers on strengths, lived experiences, healing, and well-being. If at any point you need to take a break, we encourage you to take care of yourself and return when you are ready. Please prioritize your well-being. I'd like to open with a poem called The Spirits Arrive from a book of poetry called There Are Still Woods by Hila Ratzabi. Sometimes I ignore them and they leave me alone. Sometimes I miss them and they return. I stayed home for 3 days during the storm. I haven't been the same since then. The spirits arrive like fireflies in my brain. They sweep the floors with their wings. One time I asked them to teach me how to tame the hurricane. They spliced the spell to my body, filled my eyes with fire, my throat with ice. Then they left the door swinging open in the rain. We have 3 stated learning objectives for this session. 1, to understand the diversity of alternative perceptions beyond pathology, examining how media bias and culture shape assumptions while dispelling common myths. 2, to explore strategies to address the stigmatization of alternative perceptions as organizations and advocates. And 3, to develop practical advocacy skills centered on compassionate relationships, emotional support, and community care to empower those with alternative perceptions. The artwork on this slide is by Hildegard of Bingen, a 12th century nun, artist, composer, and healer. She was an influential figure in the Catholic Church who made art and composed music based on visions and was considered a channel for divine wisdom. I wanted to start off by sharing this image as a reminder that alternative perceptions aren't something new. They aren't always negative, and in fact can hold strength and meaning for the person having these experiences and the people around them. Alternative perceptions can affect all of the senses. Auditory perceptions can be voices, music, hissing, or other indeterminate sounds. Some people may see visions, colors, or experience visual distortions. Many people experience smells or tastes. Sometimes these are reminders of the past that may occur when under stress. Skin sensations can range from being uncomfortable, such as a crawling feeling, or they can feel very comforting, such as a reassuring touch. Sometimes thoughts are affected, and people may believe things to be true that aren't based in reality. And again, there's a wide range of experiences that can include pleasant, unpleasant, or neutral experiences. We don't want to underestimate the effects of negative portrayals of persons who have alternative perceptions or mental illness in the news, on TV, on social media, in movies, and in other media. Violence, particularly committed by those with mental illness, is sensationalized by the media and contributes to the idea that certain people should be isolated from society. A person with alternative perceptions is usually depicted as having schizophrenia and is considered untreatable, unrecoverable, and usually has severe manifestations of the condition. Medication is usually portrayed as the only support, and people are portrayed as dangerous if they make changes to their medications. Usually, there are no positive aspects of mental illness seen. I encourage you to pay attention to how mental illness or alternative perceptions are portrayed in media and start to identify how these portrayals reinforce stigma and bias. This slide has a quote by the artist Kate Fenner, as well as an example of her artwork. I personally feel like the media portrays any kind of mental illness in a way that makes people afflicted look incompetent, violent, and lazy. It's normal for many people, which is why I'm being open about it. I don't feel like I should have to hide this. So expressing it through these drawings is one way of sharing it. On this slide, we have some myths and facts about alternative perceptions. For the first one, I already introduced this briefly previously. It's a myth that alternative perceptions are always negative. In fact, they may be positive, helpful, neutral, or support survival in different ways. And individuals can have a variety of perceptions that may feel different within different contexts. Next, we see that alternative perceptions are considered to be uncommon. They're actually relatively common for both adults and children and occur in approximately 10 to 15% of the general population. And up to 75% of people who have alternative perceptions are not considered to have mental illness. We often believe that persons with alternative perceptions can't live what we think of as a normal life. In fact, many people may live independently, have successful careers, families, or live in a supportive community setting. The most common experiences take place about once every 3 days for 2 to 3 minutes. They are controllable about 60% of the time, and they cause little to no distress and do not disrupt daily life. We are often led to believe that persons with alternative perceptions will be violent, may cause us harm, or are somehow a danger to others or society as a whole. In fact, persons who have alternative perceptions have an increased risk of being victimized by others. We also sometimes believe that medication is the only effective treatment, and that without medication, people with alternative perceptions can get out of control. However, for many people, the best treatment takes a holistic approach, which may or may not include medication. It can take time for people to find out what types of coping or other skills are most supportive for their well-being. This may include things like peer support, counseling, mindfulness techniques, creative expression, or other types of care. Let's take a moment to think about intersectionality in the context of alternative perceptions. Any individual may face oppression due to many aspects of their social identity, their race, gender, sexuality, economic status, disability status, or others that you may see listed in this graphic. These different forms of oppression don't exist separately, they are interconnected. The more of these marginalized identities someone has, the more intertwined oppressions they may face. More of these marginalized identities mean a compounding increase in the discrimination, disadvantages, and potential for harm someone may experience. For people with mental health challenges, having this additional marginalized identity can compound the oppression they face from other sources, such as racism, sexism, homophobia, poverty, or others. The stigma around having mental illness can create an increased potential for harm, discrimination, and other barriers. We need to be aware of our own identities and privilege, how privileged identities can affect power dynamics with the people we serve, and how our identity affects our perception of ourselves and others. When we think about our services, ask yourself, do I feel welcomed here in all of my identities? As well as, do others feel welcomed here in all of their identities? To bring focus on the intersection of alternative perceptions and domestic violence, we want to remember that persons who have alternative perceptions are 4 to 6 times more likely to have physical and sexual victimization. In addition, with increased intensity of violence, there is an association with increased experiences of alternative perceptions. So not only are persons with alternative perceptions at an increased risk for violence and victimization, but violence and victimization can increase their alternative perceptions so that accessing services becomes more difficult. This slide has a quote by Dr. Eleanor Longden, a research psychologist from her TED Talk, The Voices in My Head. The talk is linked in this slide, and I recommend checking it out if you have time. This quote refers to her experiences of hearing voices. She says, "Each voice was closely related to aspects of myself, and each of them carried overwhelming emotions that I'd never had an opportunity to process or resolve. Memories of sexual trauma and abuse, of anger, shame, guilt, low self-worth. The voices took the place of this pain and gave words to it. And possibly one of the greatest revelations was when I realized that the most hostile and aggressive voices actually represented the parts of me that had been hurt most profoundly. And as such, it was these voices that needed to be shown the greatest compassion and care." In this quote, Dr. Longden can help us to remember how these alternative perceptions can be directly tied to experiences of trauma, as well as a powerful reminder of the impact of taking a caring and compassionate approach. It's common to think that alternative perceptions must be a sign of a mental health condition, such as schizophrenia, bipolar disorder, or severe depression. Still, many other people have alternative perceptions for a variety of reasons. These might include traumatic life experiences, and this could be linked to post-traumatic stress disorder, stress or worry, lack of sleep, extreme hunger, taking recreational drugs, or as a side effect of prescribed drugs. Physical health conditions affecting the brain such as dementia or tumors, epilepsy or migraines. Even liver transplants have been associated with the perception of music. Also, spiritual experiences, intuition, special gifts or sensitivity, or hearing inner speech. Keep in mind how these experiences may be leveraged by unsafe partners to exert coercive control over a survivor. Modern medical treatments and medication help some who hear voices, but for others, medical providers may dismiss or misunderstand their experiences. Providers may overlook or dismiss how traumatic life events, difficult emotions, discrimination, and oppression can cause some people to have alternative perceptions. Feminist researchers have pointed out how throughout history, society has wrongly labeled women's anger, suffering, and oppression as mental illness. Diagnosis is influenced by social norms, which have been used to control and stigmatize women's behavior when it goes against social norms. Our Western medical model doesn't allow space for people to understand how alternative perceptions might be a meaningful response to adverse circumstances. Healing is about building the capability to live the life you want, which may include building a relationship with your experiences and living alongside of them, not separating them. We can't think of mental illness or alternative perceptions as something to be removed to make a person whole. Their wholeness already exists. What may have been labeled as mental illness may also be an integral part of their being and shouldn't be judged as wholly positive or negative. When we neglect to recognize how alternative perceptions may contribute to a person's life in positive ways, or how they can contribute to their creativity, empathy, or brilliance, we are neglecting to see their whole selves. This quote is by the artist Agnes Martin. It is not what is seen, it is what is known forever in the mind. With this painting, Agnes Martin was not trying to create an image of a tree, but rather a representation of what it felt like in her mind. She spoke of thinking about the innocence of a tree before creating this painting. Her artwork was a way for her to find peace and calm within, and then to share that with the observer. Studies have shown that it's less common for Americans to hear positive voices or to frame their alternative perceptions in positive ways in comparison to other cultures. When we think about the meaning we give to these experiences, how we describe our perceptions, and our relationship to our perceptions, we need to remember the impact of stigma and bias towards these perceptions within our dominant culture. And we can remember media portrayals as an example of these perceptions and bias. However, some cultures make more space for positive relationships with alternative perceptions. And culture can not only affect the meaning given to these perceptions, but also may affect the manifestations of our alternative perceptions. For example, if it is within cultural norms to feel a strong connection to ancestors, alternative perceptions may include feeling a connection to ancestors. If there is a cultural norm to have spiritual experiences, alternative perceptions may feel like spiritual guidance. For others, alternative perceptions may include feeling connected to intuition, giving meaningful warnings or advice, or being another tool to help us navigate our safety in the world. We can use the cycle of support as a useful tool when interacting with survivors who have alternative perceptions. The cycle of support was introduced in our January webinar, Building Bridges to Healing, and I encourage you to check out the recording if you weren't able to attend. The cycle of support is a tool to remind us that providing effective support for others and for ourselves requires preparation before a stressful event so that we feel ready to respond during a stressful event. Immediately following the event, we need to take time for reflection and care, and then use our reflections to help us evaluate what could have gone better and what we need to do better so that we can feel more prepared for the next stressful event. This cycle is designed to alleviate burnout and compassion fatigue for advocates and applies to how advocates support survivors, how advocates are supporting themselves, and how organizations are supporting both advocates and survivors. Checking ourselves is an important part of preparing before responding to a stressful situation. You can also practice checking in with yourself at the beginning of a day or throughout the day if you are generally under stress. Ask yourself, do I have what I need to respond? What helps me to stay grounded? How do I access additional support? Does the culture of my organization encourage self-support, and how? How am I feeling, and how might that affect someone else? We need to know the difference between when I feel uncomfortable in a difficult situation and when a situation is unsafe. This is part of being aware of how we are affected by stigma, knowing when our own bias may affect our interactions, and being sure we aren't taking discriminatory action towards someone. Remember, most experiences of alternative perceptions last just 2 to 3 minutes, and sometimes we just need to hold a calm, non-judgmental, and accepting space and be grounded and present with someone. Often, it is our response to people experiencing mental health challenges that can determine whether survivors feel our services are trustworthy and safe. By staying grounded, we can ensure that survivors feel our caring presence. When we are ungrounded, they may feel our frustration or fear, which can escalate or contribute to an already stressful situation. Unfortunately, when we start to feel uncomfortable or afraid, it can lead to survivors being exited from a program or referred to services that they may not want, that may cause harm, or that may replicate the power and control dynamics of abuse. We need services and environments that support a wide range of needs and experiences and build capacity to be able to adapt and adjust our environments to meet these needs, not ask survivors to leave because we feel uncomfortable meeting their needs. This quote is from Ellen Sacks's TED Talk, A Tale of Mental Illness from the Inside, which is linked on this slide if you want to check it out. She says, even with excellent treatment, wonderful family and friends, and a supportive work environment, I did not make my illness public until relatively late in life. And that's because the stigma against mental illness is so powerful that I didn't feel safe with people knowing. This quote describes what so many people with alternative perceptions experience, that deep feeling that you may not be accepted if anyone knows what's happening for you. That if you are honest and open about your experiences, you risk being labeled, treated differently, or discriminated against. We can do our best to hold safe spaces where people feel they can share about their experiences and ask for help when needed without facing negative consequences. There are many ways that we can work to overcome stigma, and just being here today and learning more, hopefully, will help you to feel more comfortable building connections and relationships with people who have alternative perceptions. Stigma is a barrier to seeking help, often because of past negative experiences with services. People with alternative perceptions are more likely to experience healthcare discrimination, have involuntary commitment, and untreated illnesses. Bias often leads to avoidance of or limiting opportunities for those with differences. Always consider, how are we actively welcoming to persons who are different from ourselves? Be aware of stereotypes, labeling, and how language is used by all staff within your organization. Examine your beliefs. Do you believe that mental illness does not impede living a full and satisfying life? Provide opportunities for people to make their own decisions around their life goals. And focus on building relationships with people, even if we don't understand their responses or experiences. Seek to understand and learn from others. Integrate feedback from those who are affected, and identify areas where training and policy change may be needed. One survivor-driven approach that may be useful is helping someone with a psychiatric advance directive. The laws and requirements vary from state to state, and there's a resource at the end of the slides where you can look at your state requirements. A psychiatric advance directive is a legal document that describes a person's preferences for future mental health treatment and allows the appointment of a health proxy to interpret those preferences during a crisis. This type of document can also help to prevent an unsafe partner from making decisions about someone else's mental health. Excuse me. Psychiatric advance directives are not always necessary, but can be a useful tool to support self-determination for survivors. We want to always remain survivor-driven in our approaches. It can be hard because we sometimes want to find more control when we feel a little scared or out of our depth. We want to do our best to keep an empowering stance, to keep survivors in the driver's seat and follow their lead. When someone is not currently in a crisis, offer options to make supportive connections. You may have a supportive organization in your community, or you can visit the Hearing Voices Network, which has a lot of resources and can provide connection to virtual, phone, and in-person support groups for persons who have alternative perceptions. Be aware of and know how to contact resources that support mental health, such as helplines or mobile crisis response teams. A survivor may find it helpful to talk with an advocate about the potential risks and benefits of disclosing their information to responders. Advocates can also help with safety planning around any potential risks involved if a survivor chooses to disclose their information to responders. This could be safety planning around the potential risk of insurance notices being sent to an address that could alert an abusive partner to a survivor's whereabouts. If staff feel the need to contact emergency services, first consider if this is a true crisis. This would be if someone is in imminent danger of or has already harmed themselves or someone else, not if staff are just feeling like they don't know what to do. For example, someone who is being loud or yelling isn't a true crisis, but it can make people feel uncomfortable. Consider if staff would benefit from additional training on trauma-informed crisis support, which could help to minimize the unnecessary use of emergency services. This image and quote are by Yayoi Kusama, who is considered one of Japan's greatest living artists. Her paintings feature many dots. She describes imagining one dot to represent her life, one particle within billions. She has described that the repetition of these dots helps her to feel calm. Her quote, "I fight pain, anxiety, and fear every day, and the only method I have found that relieves my illness is to keep creating art. I followed the thread of art and somehow discovered a path that would allow me to live." We want to be sure that organizations have medication policies in place that support autonomy and choice, and that these policies are easy for staff to implement. During the intake, you can ask, do you have medications? Is that something you would like support with or not? It is also supportive to have medication boxes available. Anyone who wants a medication box can have one, and it's not up to us to try and manage their medications. Survivors maintain control over their medications, and they have their own medication box with a key in their own space, not locked up in an office. If someone wants additional support, consider any safety planning needs, such as how to keep an unsafe partner from using medications against them, or if the side effects of their medications have an effect on their domestic violence risk, such as by reducing their vigilance. Some people find medications to be incredibly helpful and life-saving. Some people find the side effects to overwhelm any benefits. It can take years for a person to find a medication that works for them, and it may require that they have access to regular and affordable psychiatric care to try different medications. These are significant barriers that prevent many people from finding a medication that works for them. To support staff and survivors, we recommend using the Guide for Emotional Support. There's a link to the document in these slides, which you will get a copy of later. This is currently available in English, Spanish, French, and Korean, with additional translations coming soon. Use this guide to create emotional support plans for yourself and others when there is not a crisis or stressful event happening. Keep it as a living document that you can revisit and update regularly. It can take time to complete an emotional support plan, So you can also provide the document to survivors to look at on their own. If you're working on an emotional support plan, always start by asking, is there anything we can do to help you feel safer and more comfortable before we begin? The guide includes sample language for talking to survivors about the ongoing effects of abuse. Here's one example. If you feel overwhelmed, exhausted, afraid, or are experiencing illness, headaches, stomach aches, dizziness, nausea, or other concerns, let us know. If you want help, we are here. There are a number of options we can offer, including access to medical care, a counselor, mind-body practices, and peer support. We also can ask sample questions to build trusting relationships and create survivor-led support. For example, what tends to add to your stress or distress? What has helped in the past when you felt this way? Are there things we can do to support you? And are there things that you do not want us to do? Your self-directed emotional support plan asks us to identify what tools, resources, and supports you use to help you to feel good, calm, relaxed, grounded, clear-headed, or safe. Your emotional support plan can help you to identify when you are being affected by your work and can help you to be more present for another's trauma without taking it on as your own. When you're responding to a stressful situation, we can think about using a cycle where we listen, validate, and then offer action that is possible in the moment. And let's look at these in a little more detail. Listen. Don't ask if they think their experiences are real. Instead, you can ask, would you like to tell me more about what's happening? Avoid asking directly what they are experiencing or if they've taken their medications. This can come across as judgmental or uncaring. Instead, show caring, respect, and acceptance and ask, how are you feeling? How is this affecting you? We want to create space for positive experiences and remember that alternative perceptions are dynamic and changing. We can also build our awareness of trauma reminders or other sensory input that contributes to negative experiences, as well as what brings us back to a more positive state. With validation, we can acknowledge their feelings and be careful to avoid judgments so we are creating a safe space for sharing. Remind them that they are not alone, that many others share similar experiences, and that you intend to hold a safe space to connect in whatever ways feel supportive for them. Hold hope and remind them that things can get better, even if they are having a hard time seeing it right now. And always remember that the interpretation and meaning of alternative perceptions vary greatly, and allow the survivor to lead without placing our interpretations on their experiences. This anonymous quote was taken from a publication about understanding voices. It's important to me that my friends and family recognize that the voices I hear and visions I see are my reality. I'm not making them up. They're not figments of my imagination. But believing me doesn't mean that you have to believe that the voices are telling the truth. This is an important component of validation. We recognize that someone's experiences are real for them, but it doesn't mean we have to agree with them. The Hearing Voices Network has free downloadable leaflets and booklets with many ideas for coping. These can be incorporated into your guide for emotional support as you explore what works for you. When we offer action that is possible in the moment, use their emotional support guide for help. Always offer within the context of what they want for themselves. And you can always try some of these examples. We have some examples of mental focusing. This could be accepting that the voices are not the problem, they are a consequence of the problem, and we can hold space to find out more. You might try scheduling a time to listen to the voices and ask them to leave you alone until that time. You might try emotional focusing, such as talking about your feelings with another person or using creative expression to show your emotions. Comforting techniques might include changing the sheets on your bed or eating a favorite food. Relaxation might include breathing exercises, dancing, walking, or other movement. And distraction might include doing puzzles or other hobbies, getting some exercise, or listening to music. Organizational policy and practice can provide the foundation for positive interactions and resolving stressful situations or crisis. One of the best tools is to have a crisis response policy that is not fear-based or based on worst case scenario or based on a one-time occurrence that was difficult to manage. These policies must be clear, and staff must be able to both access and implement them. Policies should be effective in worst case scenarios and ensure that no one has to feel alone when offering support. Policies should include how to get support from other staff members, community partners, peers, helplines, or other resources in your area. Organizations should provide opportunities for ongoing training and professional development so that staff can continue to build skills. Organizations should support exploring and making connections in your community to ensure that resources are both domestic violence and trauma informed. Organizations can support and highlight the expertise of those who have lived experience and provide opportunities for those with lived expertise and experience to share their stories. Regularly review policies and practices with staff to be sure that services remain survivor-led and empowering. And one of the other most important aspects is to cultivate a workplace culture, policies, and practices that both values and emphasizes self-care and the general care of staff. When a stressful situation or crisis subsides, we need to make sure that we take time for reflection and care. We can continue to use the guide for emotional support to implement our self-care and support survivors to implement their own care. When we are feeling better, check in with yourself and the person you've been supporting. How did this go? What could have gone better? What does ongoing support look like for both of us? We can then bring feedback and requests for support to supervision or in debriefing with a colleague. Make sure this takes place in a timely manner so that any changes can be made to policies and practice and discuss what else is needed. This might include changes to environments, how we interact, new community partners, identifying needed resources, or continuing education. We also want to review and update support plans, including warning signs and coping strategies based on the events that just took place. This is our step where we are again preparing for the next stressful event, and we want to continue implementing this cycle as needed. Thank you, everyone, for being present with me today for this workshop. This topic is personally meaningful to me as one of the multiple staff members at the National Center who have alternative perceptions. I can share that for myself, healing has taken place by accepting myself, exploring the meaning of my experiences, and by cultivating relationships with people in my life that I know accept and value all of these pieces of myself that for so long I kept hidden. I hope that this webinar has provided some tools to support you in building supportive relationships based on kindness, understanding, openness, and trust, and to remember our connections and shared humanity, even when things feel difficult. If you'd like to connect, my name is again Amanda, and we have my email address here. We encourage you to check out our entire webinar series, From Crisis to Collaboration, which started in January, and we have 2 more sessions in this series. Here we have a link to our Guide for Emotional Support, as well as our Survivor Health Connections webpage, which I highly recommend checking out our resources. We also have a training series on trauma-informed responses to emotional distress and crisis. We also have a webinar on reflective supervision and a tip sheet on reflection, which may be supportive in your evaluation process. Here we have links to resources for coping, information, and peer support for persons with alternative perceptions. And we also have a directory of mental health and peer support warm lines, information on psychiatric advance directives, and a wonderful short video giving one example of an approach to understanding and coping with hearing voices. Here we have our references. And then please visit our website for more information and be sure to check us out on social media or sign up for our newsletter for all of our webinar announcements. Let's see, and I thought I would just we have a few minutes, and I thought I would see if we have anybody has any questions. And if you don't have any questions, I would love to see if you would share 1 or 2 things that you are taking away from this webinar today. If you could share that in the chat, I'd love to know what stood out as being important or relevant in your work, if you wouldn't mind sharing. It's very helpful for us to see. So nice to see all of your thank yous. It's been wonderful to share this information today. Wonderful. I would like to say many thanks to our interpreters and to our National Center team who have been so supportive in making this happen today. There will be a survey link that's been posted in the chat. Please let us know what worked and how we did today. We'd love to hear more from you. And within the next week or so, we will send you all a follow-up email with a link to the recording of today's webinar, in addition to the slides and handouts. And this will all be available on our website. You will receive a certificate of attendance for your time today, and a link to the evaluation if you are not able to take it right now. And I would say thanks again, and I hope you all have a lovely afternoon. And I'll stay on for just a couple more minutes to see if any other questions come up or any other responses in the chat. Thank you so much, everyone. Right. Thank you to everyone who's sharing in the chat. It's very helpful. Thank you so much, everyone. And I think we can stop the recording if it hasn't been stopped. And